mommies, this is Tanya, Noor's mom. So today I'm going to be speaking to you all about cradle cap in babies. So cradle cap is a very common skin inflammatory condition in babies or newborns. The medical term for it is infantile seborrheic dermatitis, which just means the baby version of the dandruff that we adults get. This seborrheic dermatitis appears in the form of thick crusty skin or greasy oily patches of skin. It can also appear in the form of scales. So scales like that on the fish, which are very dry. It can also cause the skin's color to change. So usually the seborrheic dermatitis starts from the head of the baby and it might spread to other areas like the baby's eyebrows, forehead, behind the ears, here behind the nostrils, in creases, folds on the neck and even in the diaper area. But when seborrheic dermatitis happens on the scalp, that is called cradle cap, and in this video we are going to be talking about that. So like I said, cradle cap is a very common condition in babies. 7 out of 10 babies are known to have it. Now when does this start? So cradle cap can appear anywhere from the baby being 2 weeks of age till 3 months of age. Some babies are even born with it. Now it is so common that it is said that cradle cap is said to affect 10% of all newborns by the first month of their life, and it peaks up to 70% of the newborns by the 3rd month of their life. So the peak happens at 3 months and 7 out of 10 babies do get cradle cap. Now we should understand that this is a harmless condition. It is not causing any harm to the baby. It is not causing any pain to the baby, and even though those thick crusty patches might look very itchy, but the baby doesn't feel any kind of itchiness. Also, this condition is not communicable. That means that if the baby has it, it cannot be transferred to any other individual on contact. Now, what causes cradle cap? So there are no exact known causes of cradle cap. Doctors believe that there are a combination of things that can cause cradle cap to appear in infants. So some medical evidence suggests that when the baby is in the womb, the mother's hormones that get transferred to the baby, that causes the baby's oil glands and hair follicles to produce excessive oil or sebum. And this, because of this excessive oil, it prevents the dead cells of the hair follicles from falling off, and they continue to keep on sticking one on top of the other, which leads to forming of that thick crust. Another possible cause is a growth of yeast in the baby's sebum, which causes this cradle cap to appear. So these are some of the known theories that can cause cradle cap. Some people, however, believe that cradle cap occurs in babies because of poor hygiene of the baby. But that is not true. That is a myth. Cradle cap is something that is to do with the hormones and the oil production of the baby's glands, oil glands and hair follicles. So now, how do we treat cradle cap? So cradle cap requires no elaborate treatment. Since it's a condition that is very common in newborns and harmless, it tends to resolve on its own by the time the baby reaches 1 year of age. Only in very rare cases can it go beyond 1 year of age. So now the treatment is simple. You just need to take proper care of the baby's scalp to keep it absolutely clean, and cradle cap will automatically go away by 1 year of age. So now what do you do? What is the first step? First thing that you need to keep in mind is that you need to clean your baby's scalp and wash your baby's hair daily. So there's a simple hair care regime that you need to follow. Number 1, you've got to oil your baby's hair every day. say an hour, at least an hour before the washing or the bathing happens. So you can use either a normal baby oil that is available in the market, or my recommendation would be to use an extra virgin coconut oil because it has antibacterial properties. And you take this oil and massage it very nicely on the baby's scalp and hair at least 1 hour prior to his bath. There are some Cradle Cap creams also that are available in the market. Mustela has a Cradle Cap cream. So if you don't want to use an oil, then you can use this Cradle Cap cream and apply it for around 15 to 20 minutes before the baby's wash. Now, after this step, you take a very soft baby hairbrush, or there are also some special Cradle Cap brushes that are available in the market, like this one, that you need to brush your baby's scalp gently so that you can remove some of that crusty skin. So what is the logic behind this? So that thick crust is kind of stuck to the baby's scalp. So when we apply oil to it, baby oil, coconut oil, or even that Cradle Cap cream, that kind of softens the thick crusty skin and helps in loosening it. So after oiling, we take that special brush, or we can even take a normal baby brush, hairbrush, which is soft, and we gently brush off the all the baby's scalp area which is affected by it. You will see some kind of scales or dry skin coming out. After that, you go and take your baby for a bath and wash your baby's hair with a mild baby shampoo, any baby shampoo that you're using. But if you want to use like a special baby shampoo for Cradle Cap, even that is available. Mustela has this shampoo foam that you can use. Now you gently clean your baby's scalp. So now what you're doing is you are removing all that excess oil that is on the baby's head, that you had applied only and only for the reason of removing those flakes. We don't want any more oil to stick to our baby's already oily glands, right? So after that good clean wash, you get your baby out, dry him out, and then again use that same baby brush or Cradle Cap brush to brush off the flakes again. And that is all that you need to do on a daily basis. This is a basic hair care regime that will keep your baby's scalp absolutely clean, healthy and hygienic. Now there are some things, however, that you need to keep in mind. Number one, please don't use olive oil for this purpose, because studies have shown that olive oil can increase the growth of yeast in the baby's skin glands, oil glands, which can further cause infection. So please avoid any kind of olive oil. Secondly, please do not apply any kind of antifungal creams or anything or any OTC medication buying from the chemist on your own without it being prescribed by a doctor, because it can sometimes aggravate the infection if it is not that severe. Next, please do not leave oil overnight on your baby's scalp. Thinking that if I leave the oil overnight on my baby's scalp, the scales will become even more soft and they'll easily come out, and quickly I'll remove all of them. So no, that is not going to happen. Those scales or that thick crust will come out on its own. It will take its own time, and if you put that oil overnight, that will further cause that oil glands to become further oily, and we don't have to do that. We've got to clear out of all the excess oil, and oiling is just to soften the scales. It is not for any moisturization. Next, please do not scratch or pick on your baby's crusty skin or scales here and there. As parents, we want our babies to look very pretty and beautiful, and aesthetically these scales don't look so good. So we are in this hurry and we're looking for home remedies everywhere, trying to just remove the skin. And sometimes if we see that a small scale is almost coming out, we have this urge to go and take it out from pick it out. Don't do that, because if you do that, you will actually cause further infection to spread, because the skin that is coming out of, that will be new skin and prone to more infections. So please don't do that. Let the scabs fall off on its own. Lastly, in case after, there's a possibility that when say a part of the patch falls off, some of the baby's hair also falls off. So it's very common. It is normal. Don't worry, your baby's hair will come back. This was the basic hair care regime that you need to follow, along with some do's and don'ts. But now, in case you see that your baby's scalp area, those thick crust areas are kind of getting infected, in the sense that there is some blood oozing out, or you see some pus, or it is causing any discomfort to the baby. The baby's time and again reaching his scalp and itching continuously, or if you see that it is spreading to other parts of the body, like I had just told you, where all it spreads, then please go to your doctor, because then he might diagnose it to be a severe case of cradle cap and prescribe some antifungal creams or some medicated ointments or shampoos for your baby. So this is very rare. It is not common that you will need all of these elaborate medical treatments. Usually for most babies, it corrects on its own by 1 year of age if you follow this basic hair care regime. Lastly, once all of the baby's cradle cap falls off in the form of scales or crust or whatever, and the baby's scalp is clear, it doesn't mean that the infection cannot come back. You need to still maintain the same hair care regime that I told you, and keep your baby's scalp absolutely clean and healthy, so that those scales don't come back. So continue daily wash, daily oiling, and you will see that your baby's hair will be absolutely healthy. Okay, so now if you're concerned that if I wash my baby's hair daily, my baby's hair is already so scanty and sparse, he will lose so much hair. So washing your hair every day does not cause you to either grow hair or even lose hair. If you go to any dermatologist, even as an adult, he will tell you to wash your hair every day, because it cleans your scalp and keeps your scalp healthy. So this is a myth that you should not be washing your hair daily. So don't worry about that. Your baby's hair growth depends on your baby's hair follicles. It has nothing to do with this cradle cap or shampooing or oiling. So relax. So this was all about cradle cap. Hope my video was helpful. Keep writing, keep suggesting topics. Take care. Thank you. Bye-bye.